Hi, my name is Dr. Sharif, and I'm a supportive palliative care physician on the lymphedema team, helping the lymphedema team manage patients with breast cancer-associated lymphedema, helping these patients with their symptoms and also diagnosis and management of lymphedema. So our objectives today, we'll be talking and defining lymphedema, talking about the difference between primary versus secondary lymphedema, discussing the different stages of lymphedema, the cause of lymphedema in breast cancer patients, how to diagnose lymphedema, and looking at the treatment, mainly in our lecture today, surgical as opposed to non-surgical options for patients. So before we talk about lymphedema, let's look at the lymphatic system. The lymphatic system is basically involved in removal of excess fluid from tissue, absorption of fatty acids, and subsequent transport of fat as chyle to the circulatory system, maturation of immune cells, but it also supplies a path for cancer spreading. This is the anatomic view of the lymph vessels throughout the body. The lymphatic system drains the right upper extremity and one half of the face into the right thoracic duct, while the remaining 2/3 of the body, including the lower extremities, the left upper extremity, and the remaining half of the face drains into the thoracic duct. Lymph flow depends on three things: forward flow, lymph vessel lumen patency, and lymph vessel contractility. Here we have the basic architecture of a lymph vessel, and you require that these valves be closed so that flow can go in one direction. This is a picture of normal lymph nodes connected by lymph vessels. And often in breast cancer-associated lymphedema, we're looking at the lymph vessels in the armpit or axilla area. Lymphedema is caused by scar tissue, and that can be affected by either radiation, surgery, and basically the scar tissue, as you can see here, causes abnormalities in the lymph node and lymph vessel architecture. The lymph vessels here are narrower compared to the normal lymph vessels. This abnormality causes basically a backup of fluid and also backup of drainage of fat. And when you look at the normal arm here compared to the lymphedema arm, you'll see the difference in swelling and also loss of architecture of the lymph vessel vasculature. In a systematic review of 72 studies that involved close to 30,000 women, the overall incidence of arm lymphedema in breast cancer survivors equaled about 17%. Lymphedema risk factors include surgical removal of lymph nodes, radiation therapy to lymph nodes, scar tissue, cancer spread to lymph nodes, pressure from tumor on the lymph vessels themselves. They can also be caused by inflammatory conditions, most notably autoimmune diseases such as rheumatoid and psoriatic arthritis. Older age can be a lymphedema risk factor. Obesity, there was a study looking at BMI in diagnosed breast cancer patients that were greater than 30, had an increased risk of lymphedema compared to patients with a BMI less than 25. And also some cancer therapies such as taxane therapy after surgery can cause lymphedema. Signs and symptoms that affect quality of life. In this picture here, you see the woman has a much swollen left upper extremity after surgery. This patient may experience swelling, heaviness or tightness, restricted range of motion, aching or pain, decreased movement in the upper extremity, hardening and thickening of skin, and may also be prone to repeated infections. When we look at lymphedema, you can look at the etiology as either primary or secondary. Primary is usually inherited diseases or congenital. For today's talk, we'll focus more on the secondary cause with breast cancer-associated lymphedema. Worldwide, there's about 250 million cases of lymphedema. In the US, this is mostly post-surgical after lymph node removal, radiation, trauma. In the world, outside the US, this can be due to a roundworm parasite causing filariasis and swelling of the extremity. When we look at stages of lymphedema, one way to look at them is using the International Society of Pathology, or ISL staging. This is taken from the Lymphatic Education Research Network. Stage 0 is latent. There may be lymph system injury, but as you can tell, there's not really a difference in the arm circumference between the two arms. In stage 1, this is known as the acute reversible stage. There's visible swelling in the extremity. The extremity may be normal in the morning, but worsen throughout the day or at the end of the day. The key difference here is that the extremity may improve with elevation. In stage 2, this is called the irreversible chronic stage. You'll see that there's increased swelling in the upper extremity compared to stage 1. In this stage, however, there's no improvement with elevation. The skin is starting to harden, and also it does not pit. And pitting is basically, you can leave an indentation after you apply pressure to the area. In stage 3, you can see the arm here is much more increased in size. This patient may be also having pain, limited movement, and functionality, and may need help dressing themselves or performing what we call their activities of daily living, taking care of themselves. This is irreversible, end stage, and often referred to as elephantiasis. The tissue here is very hard and fibrotic. So how is lymphedema diagnosed? History and physical. Going back to the previous slide, often we can do a test called Stemmer's test, which is pinching the second digit here, and if we cannot grasp the skin, that's indicative of lymphedema. We also look at the comparison of extremity measurements, lymph circumference and lymph volume, usually measured by a lymphedema therapist, and looking at the time between surgery and onset of swelling. You can develop lymphedema acutely after a lymph node removal. However, this usually can resolve quickly. Patients can have delayed onset lymphedema within 3 years after surgery and for breast cancer. Patients may even have symptoms after the 3-year period. And then we also look at imaging. So when we look at imaging, remember, we're looking for any impedance to forward flow. We're looking for any narrowing of this lumen area. And we're also looking at the decreased contractility of the lymph vessel. One or all these things have to be involved in order to cause lymphedema. So first, we often do a venous ultrasound, which is basically looking for elevated pressure in the venous system, valves that are insufficient or not working, or also blood clots. These can contribute to swelling in the extremity and must be used to detect these diagnoses. A lymphoscintigraphy scan is basically a nuclear study looking at the lymph vessel physiology and looking at the areas where which lymph nodes are draining. We often use this with a CAT scan for a 3D view of the lymph nodes and for a lymph node transplant. It's basically a test where a dye is inserted into the web of the fingers, and images are done at 30 minutes and 120 minutes, as well as after an activity of using the extremity to see where there's areas of lack of lymph vessel flow. Indocyanine green, or Icg lymphography, is a key study using a dye and attaching that to a protein called albumin in your body, and looking at the lymph vessel anatomy. If the lymph vessel is leaking, it looks at the contractility of the lymph vessel and also valve reflux. And it's a key study used in staging and also pre-op for lymph node surgery management. On this upcoming slide, I'll show you that how this lymphedema study is used in actually another staging. An MRI is a very detailed view of lymphatic vessels, lymph nodes, which help in lymphedema diagnosis and prep for surgery. One thing to note, however, is that the contrast not only is taken up by lymph vessels, but can also be taken up by veins. And a CT scan shows thickening as well as swelling underneath the skin. So this is the Icg lymph staging. And although there's a lot of things going on in this slide, I think the main thing to look at is how you go from least severe lymphedema to higher stages where you have the most severe lymphedema. And again, the key thing here is that it is talking about the three things that are involved in lymphedema. So in the normal stage here, you'll see that you have the dyes inserted and you'll have normal lymph vessels, and you sort of get this uniform distribution. In stage one, you'll have the normal vessel architecture here, and then all of a sudden it becomes patchy, indicating that backflow or the valves aren't working properly. Here you'll have increased backflow in the upper arm. And here it continues to get worse as you go through the additional stages. So as you start to go through the stages, it will show the patency of the lymphatic vessels, which start to become fewer and fewer. And then in stage 4, there's no patent lymphatic vessels. And this may be due to just the degree of maybe adipose tissue or fat tissue and lack of architecture in the vessel lumen, causing obstruction. And then also this tells you the contractility of those lymph vessels and the decreasing contractility as you go along with the severity of lymphedema. Moving on to breast cancer-associated lymphedema treatment. Breast cancer-associated lymphedema treatment is patient-centered. Starts with the patient and then also their friends or family or support system at home, their oncologist, a reconstructive surgery team or plastic surgery team, a physical therapist, occupational therapist, radiologist, a nurse navigator to help with scheduling, internal medicine or supportive care physician, integrative or naturopathic provider, a social worker, and nutritionist. I can tell you on our lymphedema rounds, we're very involved with all the team members here in helping with patient-centered treatment in patients with breast cancer-associated lymphedema. Treating lymphedema, non-surgical therapies, physical therapy, compression, massage, elevation, pumps, exercise, and weight loss. And I'll defer this further to Gina Smith, who will be talking about this or has already spoken about this. For surgical means, the goals of surgical management of lymphedema are to decrease pain and discomfort, maintain limb function, reduce the risk of infection, prevent disease progression, and minimize limb deformities. The procedures that are involved, we break them down into two categories, lymph vein bypass and lymph node transplant, which are microsurgeries, and you're dealing here with diameters of blood vessels, which are 0.3 to 0.8 millimeters, so very small. And then also excisional procedures, which are focusing at removing either fat, which is liposuction, or debulking, which is removing actual fat and surrounding tissue, because it has become such a deformity and stress on the patient. Do these procedures, do they cure lymphedema? In most cases, no, but they can improve the severity of the lymphedema. They can reduce the complications related to lymphedema, such as recurrent infections, and they can improve the quality of life. Our first physiological procedure is lymphaticovenular anastomosis, or a lymph vein bypass. And basically, this is it's a small skin incision and taking an area where you have lymph vessel obstructed and connecting it with a vein so that the lymph vessels can now drain into a vein and go back to the heart. This procedure has shown much improvement in quality of life in decreasing arm lymphedema circumference. It is minimally invasive, short oral OR times, and short hospital stays. Usually reserved for early stage of lymphedema. Vascularized lymph node transfer. This is basically doing a lymph node transplant. So you can see here, this is the area where the patient had a mastectomy and lymph node removal. There's swelling in this left arm compared to the right arm. And so there's damage here in this area where lymph nodes are, and possibly there may be lymph node removal. There may also be radiation in this area. And so what is done is usually lymph nodes are taken from other areas of the body. Now, during breast reconstruction, this can be done at the time of surgery, where a lymph node, artery, and vein is removed from the lower abdominal area and inserted here, as you see here. Or it can be taken from other areas of the body, such as in the sort of collarbone area, the chin, areas that are usually focused on, however, because of least side effects, are lymph nodes taken from the sort of abdominal area. And this form has also shown improvement in lymphedema swelling, to the point even with 3 years out, 65% of patients did not have to wear garments. Excisional techniques are reserved for patients that have later stage lymphedema where the fibrosis has been very severe and the swelling is to the point where it's affecting limb movement and discomfort. So the first one, liposuction. Indications for this is that non-pitting edema, because the skin has become fibrosed. You have a lot of fat tissue that is built up because the lymph vessels can no longer drain the fat. And basically non-pitting edema patients that have failed non-operative management with CDT therapy or manual therapy for greater than 3 months. And these are your patients that have been compliant. There may be an arm volume difference between the affected extremity and the normal extremity of about 600 milliliters. Symptomatic complaints that include heaviness of the shoulder and or neck strain or pain. And you'll often note that patients that have this extreme shoulder heaviness and it's difficult to use their extremity, it often affects their posture and you might see them leaning to one side. Functional impairments and recurrent infections are also indications. Contraindications to liposuction is basically cancer of the affected arm or open wounds that aren't healing. Upper extremity studies have shown that patients that receive liposuction have a greater than 90% reduction after this procedure. Debulking of fibrotic tissue involves excision of the mass or lymphedema surrounding the arm. in addition to, so this is not only the fat tissue like in liposuction, but also the surrounding tissue. But also, if the area is very large, it may involve skin grafting. That's called Charles procedure. This is an example from a journal article where you have a patient with stage 4 Icg staging. So this is the most severe stage of upper extremity edema in the left arm after a breast cancer surgery. And then 12 months after liposuction, in addition to actually this patient had a lymph node transplant, they had a decrease of this arm swelling by 101.4%. This arm here is their normal arm. So they usually often compare the percent decrease in the normal arm. Candidates for surgery in general. So early stage diseases are better candidates for lymphoventricular bypass, lymph node transplant compared to later stage patients. Surgical intervention is indicated for those with persistent lymphedema after 3 to 6 months of complete decongestive therapy. Persistent swelling despite non-surgical therapies, recurrent cellulitis. If there's leakage of the lymph into the surrounding body cavities, externally or in organs, limited movement in the limb and or limb deformity, worsening pain, and especially if this is affecting the patient's quality of life. Patients that may not be candidates for the lymphatico-venous bypass or lymph node transplant, if they have severe tissue fibrosis or late-stage lymphedema changes, venous hypertension assessed by ultrasound, recurrent cancer in the same side extremity or metastasis, non-compliance with compression therapy or post-op care plans. Also, the ideal BMI for these surgeries is less than 33, a non-smoker, and not actively on treatment. So going back to our stages of lymphedema, again, looking at the ISL stages, which are mainly clinical, you'll see that at stage 0, where you don't have any visible swelling, it's usually 3 to 6 months of observation. Stage 1, where you have that pitting edema, where you can leave an impression after pressing the area. Remember, fibrosis is not set in. So these cases where the lymphedema is not that extensive, the surrounding vasculature, like the veins and the arteries and the architecture of the tissue, is still intact. So these patients are usually great candidates for a lymph vein bypass. Again, a minimal procedure. Stage 2, where you start to have pitting. Again, these patients, even though they have maybe early onset of fibrosis, they could be candidates for lymph vein bypass or lymph node transplant. They also may be candidates for liposuction to remove the surrounding fat around the area for improved mobility. And stage 3, usually patients are assessed for more of the liposuction, removing the fat, and also direct excision. So it's usually liposuction or direct excision, and may even be considered for a lymph node transplant afterwards, as well as we saw in the example. The main thing also is that even before these procedures, in stage 1, 2, and 3, we have to also make sure the patient is receiving 3 to 6 months of compression therapy with their lymphedema therapist. And the reason behind that is that the manual therapies and pumps are helping restore lymph flow to where it should be, so that it's not building up in the arm. It'll also make a better recovery for post-surgical interventions. Looking at our second set of staging, which is the Icg staging. Now, this is what we saw, where you're looking not only now at the clinical physical aspect of a patient's lymphedema, but also the physiological aspect. I think it's very important to look at this, even though I'm not a radiologist, but the degree of the physiology and pathophysiology involved in lymphedema. Again, you can look at patients being candidates for a lymph vein bypass early on, or lymph vein bypass on lymph node transplant. And then as you go, as you have more severe disease, with the backflow and poor architecture of the lymph vessel system. Again, looking at more of those excisional surgeries, liposuction or direct excision. And the key thing, though, is that lymphedema therapy has been evolving very quickly over the most recent years, and it's also best to discuss with the lymphedema team and lymphedema specialist in order to see that sometimes these therapies can be combined. Even more so, looking at lymph node transplant or bypass early on, even after mastectomy. And that's why you need a team, because not one size fits all here. New and emerging treatments, well, using stem cells to differentiate into lymphatic tissues, using something called the vascular endothelial growth factor to create new lymphatic vessels and decrease lymphedema. This is something that's also natural in the body, and how you have what we call lymphangiogenesis, or creation of a new lymph vessel. Applying topical tacrolimus, which is an immunosuppressant medication used in basically patients receiving transplant, so they don't reject the transplant. And it's basically involved in inhibiting T cell proliferation and preventing the development of lymphedema, which has been studied in an experimental model. So basically looking at inflammation and the autoimmune response on lymphedema. And then you're looking at anti-inflammatory medication is also ongoing, since there's a part of this which is due to inflammation. Thank you for listening, and I'll take any questions.
Hi, everyone. I'm Joanna Hazard. I'm the Director of Nutrition at Cancer Treatment Center of America, and I'm looking forward to speaking with you about nutrition and how it can help your lymphedema. So some of the things we're going to be talking about today, briefly, I'm going to talk to you about what is lymphedema, just in case you're not exactly sure. Then we're going to look at nutrients that might actually impact the severity of lymphedema, and then some quick and easy recommendations that you can start today. So what is lymphedema? So it's an inflammatory condition, and many people don't think of it as such. So lymphedema in general is commonly known as that swelling that you might see in someone's arm, or it can really impact any part of the body. But generally it occurs after there's been some sort of a disruption to the lymph nodes or the lymphatic system. And the lymphatic system circulates fluid throughout your body. So when you have that disruption, sometimes what you get is an accumulation of that fluid in a limb, and I'm holding my arm because that's one of the most common areas. You'll have that fluid accumulation in the limb because the fluid, it just can't get back up and circulate through your body. So you'll see on my slide here, you'll have this lymphatic impairment that it causes some inflammation and fluid accumulation in the body, which actually creates fat deposits in the arm or the affected limb. So if you've had lymphedema for a long time in the limb, over time, it can get worse, and you'll see the limb kind of get bigger and bigger. And often it's thought that volume is just extra water. But actually what happens is you actually do get fat that deposits in that limb because of all the inflammation. It's just this metabolic reaction that happens. And so what happens is you have this fat deposition, which actually makes the fluid going back and forth or circulating around even worse, which creates more inflammation, which creates more lymphatic impairment. So you get this circle that just goes around and around and around. And if you don't do something to stop that vicious cycle, it will continue to just get worse. So how does nutrition play a role in this? So first and foremost, when I have somebody in front of me with lymphedema, I talk about nutrition for inflammation. Because lymphedema is inherently an inflammatory condition, much of what you eat can either decrease your inflammation or increase your inflammation. And you can see pretty significant results by changing the foods that you eat. So just kind of big picture, some of the foods that are going to decrease inflammation, not surprising here, are going to be your fruits and your vegetables, of course. Those are your main sources of antioxidants and just anti-inflammatory, anti-cancer, immune supportive nutrition. In addition, I want you to make sure you're focusing in on those healthy fats and omega-3s. So things like, olive oil and avocados and fish. So those are what help decrease inflammation. Now, on the other side of this little scale here, probably not a surprise, those foods that are going to increase the inflammation, sugar, right? Everybody knows sugar is probably not the best for you, but sugar is actually very inflammatory. It kind of worsens that metabolic response that you see in that limb. And then the same token, all that processed food. So you can see in the little picture there what I mean by processed food. So all the goodies and all the things that we love to kind of munch on. But those are very inflammatory. But it's not like you have to eliminate these things altogether, but just kind of rebalancing that scale a little bit so that you have more of those really great anti-inflammatory nutrients in your diet. I always like to talk a little bit about salt and fat as well. So sodium or salt it helps your body to retain water and fluid. So the more salt you have in the diet, whether it's through the foods that you eat, like packaged foods or some processed foods, or just the salt shaker, it all contributes to the amount of sodium that you're consuming in a day. And the more salt you're consuming, the more water you're going to hang on to. So it is recommended to keep your sodium intake kind of on the lower side of things, about 1/4 of a teaspoon to 1/2 teaspoon a day. It's not very much, but it's enough to give food a little bit of flavor. You know, and if you're someone who's just a salt addict and you're just adding the salt all the time, please know that salt is an acquired taste. It is one of those things that if you start to slowly reduce it, you won't want it as much. And if you were to go back to have food as salty as you used to eat it, it would just be way too salty for you. And there's definitely some nutrients like sugar and salt that the more you have, the more you want. So if you're somebody who's really, really heavy on the salt, or maybe you just don't know if you're a heavy salt consumer, you know, start to pay attention, start to read your labels, try to keep your intake between 500 to 1,500 milligrams a day, which can very easily be done. It's not unreasonable to try to keep your sodium to that level. Really pay attention to your processed and packaged foods. Anything that comes in a box or a can, packaging that has that food label on it, it probably has an increased amount of salt. It's a major preservative, and it also just helps with the flavor overall. So read your food labels, pay attention. And if you're eating according to that little food scale on the last slide where you're increasing your fruits and your vegetables and your healthy whole real foods, just naturally the amount of salt you take in is going to decrease. So it may not even need that big, it's not that big of an effort for change if you try to switch up your diet a little bit in that way. Additionally, so I want to talk about fat a little bit. So, you know, I don't want you to be fat phobic, but be smart. So healthy fats, as I had mentioned a little bit before, things like avocados, olive oil, some of these fatty fish like salmon or mackerel, eggs, nuts, and seeds contain wonderful anti-inflammatory nutrients. They're very protective of the heart, and they just help to create a more calm environment in your body overall. Most people are afraid of fat, especially if you're getting fat deposition in that limb. Why would I want to eat more fat? So it's about having the right types of fat to balance that inflammation. Now, there actually is some evidence to show that eating too much fat or eating the wrong types of fat can increase the lymphatic or the fluid volume in the affected limb, which is really, really interesting. So fats are typically metabolized and transported around the body in the lymphatic fluid. So it would make sense that the more fat you eat, the more fluid volume you're going to have. And I've read some studies that you can actually increase the fluid volume in an affected limb or in your lymphatic system by at least 1 liter a day, just by the amount of fat you're consuming. Now, an extra liter of fluid a day in your lymphatic system, you're going to see some extra swelling that day. So the types of fats that contribute to increased lymphatic volume, I have listed here. So you can see dairy, red meat, trans fats. So those artificially manipulated fats that you'll see in some of your cakes and cookies and some of your goodies. It's a preservative that gives food its really long shelf life. Deep fried foods, and again, your baked goods. So what I would say is that, the types of fats that I have listed out here in that bullet point are more on the inflammatory side to begin with. So if you're trying to rebalance out your inflammatory foods, you're going to want to eat a little bit less of these. You don't have to cut them out altogether, but less is more when it comes to these types of foods. And you want to increase some of those healthier fats. So I have for you kind of a recommended eating pattern based broadly on some of that stuff I've gone briefly through. So I want you eating primarily a whole foods diet, mostly plants. Doesn't mean I want you to be vegan or vegetarian, but I want to see fruits and vegetables in your life. You may have heard of the 5-a-day campaign for fruits and vegetables, where you're supposed to eat 5 servings of fruits and vegetables every day. So, consider doing that. And I say 5 is the minimum, not the goal. You should be eating at least 5 servings every day, while avoiding some of those inflammatory foods and those fats that contribute to lymphatic volume. So the added sugar, the refined grains, and those trans fats. And you can see the little chart here on what foods I want you to consume on what time frame. So every day I want you eating all those bright, beautiful fruits and vegetables, beans and legumes, sweet potatoes and whole grains, and then fermented foods actually to help support healthy digestion and a healthy immune system. And then kind of moving through the chart, you can see, eat a few times a week. So there's some of those more, inflammatory, maybe not the best types of foods or fats, but, you can have them a couple times a week and you're going to be just fine. I put dark chocolate in there for my chocolate lovers, but try to keep it to the dark stuff, 70% dark or better. At 70% or better, you get incredible health benefits. If you're a cancer survivor, dark chocolate has actually been shown to help reduce cancer recurrence. It helps to reduce tumor cell growth or blood vessel formation in cancer cells. So it's really cool stuff. In addition, it's delicious and wonderful, and it's very protective of your cardiovascular system. And then, of course, eating rarely, all that stuff that we talked about, all of that, you probably shouldn't have it. You inherently know that fried foods and sugars are not good for you, but just another reason to maybe try to reduce them as much as possible. So please definitely let me know if you have any questions. More than happy to take any.
Good afternoon. My name is Gina Smith. I am the Director of Rehabilitation and Integrative Services at Cancer Treatment Centers of America in Philadelphia. My portion of this segment is to present on World Lymphedema Day, which is coming up March 6th, and then introduce the role of rehabilitation in early and late stage lymphedema, as well as the World Lymphedema Day initiative. This might be a repeat slide. I know Dr. Sharif had shared a number of our team with you, but this is our clinic team. Rehab is part of a team of providers, all of whom have something to offer a person with lymphatic disease. A certified lymphedema therapist is typically a rehab professional with specialized training in the treatment of lymphedema. Treatment we know can be costly, and from an insurance perspective, rehab professionals can bill for therapy related to treatment, management, surveillance of a person identified as at risk for lymphedema. We know also much of these costs are in the supplies associated with those interventions. However, you need to know there's also many skilled professionals that can obtain that certification, that CLT credentialing. There can be nurses, massage therapists. I've been in classes with physicians as well. Fortunately, the Center for Medicare Services requires that a person providing hands-on therapy must be a licensed PT, OT, a PT assistant, or an OT assistant. And the reason is the 4 CPT codes or the billing codes that they use to provide treatment are designated as always therapy, regardless of who bills for them. So it's a good information so that you know when you're meeting with a provider that, one, that they're certified, but 2, that you're able to take advantage of many of your insurance opportunities. The stages of lymphedema progression, this is just a quick review of those stages and the symptoms as it pertains to how we can early detect and treat symptoms. Early stages are stage 0 and stage 1, also something that maybe Dr. Sharif had shared. Early symptoms is when we know that you have a risk for lymphedema, but you're just starting to feel a little achy, maybe a tightness of the skin or heaviness without any known reason other than I have a risk on that side. Stage 1 is also an early stage, and that's when you may start to see a little bit of swelling, but it's called a spontaneously reversible stage. So you might see it and it might go away. And you might wake up the next morning, no swelling. By the day it goes on, it returns. So that's an up and down behavior for lymphedema. Stage 2 and stage 3 are more advanced, and what we'll see is it becomes less of up and down. It may stay in longer, some of it goes down. Usually when we're talking about fluid, that will have an up and down ability, but lymphedema over a long term will transition to more of a fat, and that's when we really get late stage 3 lymphedema. Each of those stages warrant a different type of intervention. Our phase 1 of conservative treatment is called complex decongestive therapy, and that's again by the certified lymphedema therapist. We're going to evaluate your symptoms based upon the scale of progression, determine whether we need to do an early intervention phase 1 or phase 2, complete decongestive therapy. And that CDT is comprised of the same 4 things. It's manual lymph drainage, it's compression, it's exercise, and skincare. We want to optimize your physical activity and your exercise, but also give you resources to get support, because this is something that you may be having to manage or be concerned about over a lifespan. The first phase is done with the therapist. The second phase, same 4 things, but it is your self-management. As Dr. Sharif mentioned earlier, diagnosis of lymphedema can be tricky and involve many steps, potentially leading to a radiology study and other studies. Often patients do come to rehab as a direct referral from a physician office, and usually the therapist is tasked with supporting a diagnosis, but you need to understand we're also partners in this assessment. Therapists are not licensed to diagnose, but as many primary resources for treatment, we have been given that responsibility, and that collaboration between your physician and your therapist is really important. But ultimately, the physician is the one to diagnose the lymphedema. Conservative treatment approach includes, again, those 2 phases of 4 interventions: MLD, compression, exercise, and skincare. CD2 is self-management. So when you're considering a surgical option for lymphedema, you often read that you need 3 to 6 months of CDT. That's important to know, but it's not 3 to 6 months of therapy. It's 3 to 6 months of therapy plus your maintenance. The 2-step intervention, and we transition to a self-management phase by being compliant with compression, exercise, skincare, and manual lymph drainage. If all of those are appropriate, you're supporting that full time frame of CDT into. Again, repeat information, but the earlier the stage, the better the outcome. The earlier the stage, the easier it is to treat. So just taking a look at those stages again, you want to take a note as to how that extremity that is at risk is behaving, how it feels. Is there any reason why it might feel achy, or is there any signs like my rings aren't fitting properly on that at-risk limb? Usually in the arm for breast cancer, it has to do with bracelets, rings, dressing, tight arm sleeves, things like that. And then of course, obvious swelling as the stages progress. Goals for World Lymphedema Day. This is a worldwide event held on March 6th, and we've been doing this since 2016. In the United States, breast cancer-related lymphedema is the #1 reason for this disease, and I do refer to lymphedema as its own disease. It's a disruption of a normal function. So what you may have gleaned from the earlier portions of this presentation is the challenge of diagnosing lymphedema is often a result of awareness. There is an educational limitation in medical schools. They admittedly will tell you maybe 15 to 30 minutes of time was spent on lymphatic education in medical school. So we know that raising awareness has to be #1, and that's the #1 goal for Lymphedema Day. What is lymphedema? How do you identify it? How can we direct you to the more information if you think that you have it? We need to engage our clinicians. Clinicians need to know signs and symptoms of lymphedema and the difference between a primary and a secondary lymphedema, and for cancer-related lymphedema. They need to know who they can direct their patient to for care and support. We need to also tell our politicians to advocate and to sign off on the Lymphedema Treatment Act, which is now awaiting reintroduction in our current 117th Congress. The LTA was first introduced in 2010, and it's a federal bill that aims to improve insurance coverage for the medically necessary and physician-prescribed supplies necessary to manage this lifelong disease. The history here is that the CMS, or Center for Medicare Services, is not able to redefine durable medical equipment, and the necessary garments and supplies unfortunately don't meet that longevity requirement. They only last about 6 months. I say 6 months too because we need to make sure that we're following up and replacing these supplies when they start to wear out. They are not meant to last more than a few months depending upon how aggressively you use those garments. But only Congress can make that change, and legislation is how it gets accomplished. So the Lymphedema Treatment Act is really an important awareness that we need to lift up. We need to make sure our politicians realize the scope of the problem, how many patients are affected, know that lymphedema is a chronic condition, and that the issues surrounding getting a diagnosis and adequate treatment. 3 to 5 million people in the United States suffer from lymphedema, and that's not all breast cancer, but it is pretty prevalent in our country, and it is a worldwide condition. Lymphedema Education and Research Network is a national patient association that advocates for legislation for funding and research and is an educational resource for clinicians and patients. Their accomplishments in raising awareness is a long list since 1998, and I encourage you to check out their website at lymphaticnetwork.org. We need to share our knowledge with the community and with clinicians and give access to resources to empower both of these groups to better identify, treat, and live with lymphedema. Organizations like the Lymphedema Education and Research Network offer information without charge. There are some resources you can download and share with your healthcare provider or legislature. So here's a few of them on the slide. The Do's and Don'ts for Clinicians is another website that's available. 10 things you want to know when you learn you have lymphedema is one of those really good tip sheets that you can give out to your providers or to your politicians. Start by also sharing with local legislators who are most inclined to respond to a constituent, a phone call, an email, or a letter for personal introduction and maybe a compelling story. World Lymphedema Day is March 6th, so there's some activities to look out for, and there's also ones that you might want to lift up on your own. Some examples are events such as today, our panel presentation to educate on breast cancer-related lymphedema. A lot is virtual now, so look for online activities and events. The Cancer Support Community of Philadelphia hosts a bi-weekly lymphedema networking group and is doing a panel presentation today, including our speakers and local independent lymphedema therapists, as well as a vendor from Tactile Medical who supplies lymphatic pumps. All great people to talk to and just pose some questions to and get more information. What can you do is a great question. Send your email and mail to politicians. Can't say that enough. Post top facts about lymphedema or your testimonial on social media. Post information on the difficulty of getting correct diagnosis, of getting quality treatment, and maybe personal expenses that you're incurring that aren't really covered by insurance. Most people aren't really aware of the challenges that it is to take care of that. Because the treatment is covered, the supplies can be extremely costly, particularly as you get into a later stage condition. Create your own event, post it with hashtags. This is an example of an event in Italy. Only Italy can do it this way, but this is how they posted their positive catwalk, body positive catwalk. Definitely, where in the world? This is a list that you can go to and find out what other countries are doing to celebrate World Lymphedema Day. It is located on the Lymphedema Education and Research Network's website. And we at CTCA certainly took advantage of that opportunity and are lighting up our building in the teal color associated with lymphedema. So the question is, what can you do today? I think this is a few points to start with. Hopefully this education gave you a little bit more information as resources that are available to you, but also how to advocate for yourself and to raise the awareness that gives more funding to research, more return to your pocket as far as the costly interventions that are involved in lymphedema, and also to give a little better understanding to people in your community and your families to understand what you actually are maybe dealing with more in the long term. Thank you very much for your time and your interest and your support in raising the awareness of lymphedema and lymphatic diseases. And just a reminder, it is March 6th every year for the last 6 years. Thank you.